friends, welcome back to my channel. Today I will be talking about cough, and this is super personal. I really was not sure if I wanted to make this video. I've been thinking about it for a very long time and then decided that maybe it is in our best interest, meaning the community on YouTube, because I couldn't really find anything that was like personal from someone else who has gone through this. So if you're here because of your cough issues or, just searching about cough, I really would appreciate if you comment on this video and let me know what your thoughts are, or if you're in the same situation, or maybe someone that you know is in this situation, and how you guys have treated it, or if the same methods have worked for you. So let me get started by saying that for the last 10 months, or 10 months ago, I should say, I started this very annoying dry cough that came out of nowhere. I wasn't sick, I didn't feel sick, and I personally thought it was allergies. So I started taking my usual Claritin routine, and I took that for like a whole month, and nothing really happened, meaning it didn't help. I was also out of the country for a little bit, and so it wasn't anything that I would have been allergic to that maybe I had here in the house. I actually traveled quite a bit at the end of last year, and it didn't matter where I went. That cough was there. It was persistent. It was annoying. And what would trigger the cough was talking and coughing. I could go through the entire day if I was by myself and not working. As long as I didn't talk or laugh, I didn't have a cough. So when people ask me, well, what about at night? Do you sleep okay? I slept just fine. I always do. I never had a cough at night, So it only was triggered by those two things, the talking and the laughing. So I have a job where I have to talk to people, like most people do, right? And it was very difficult because once I got talking for like the first couple hours of my shift, it only got progressively worse. So the more I talked, the more I coughed, and it got to the point where I couldn't have a whole sentence without coughing. So I would have to mute myself, or if I was, seeing someone in person, it was just like, sorry, and it was just this quick kind of cough, not like a productive cough or, let me clear my my throat cough. It was just a very annoying dry cough. So after a while, I went to see, and I'm gonna get my notes because I really wanted to make sure that I'm not missing anything when I'm telling you my story. So I also, before I went to the doctor, I had tried cough drops. I tried drinking hot fluids, cold fluids, just plain water, tea, you name it, coffee, anything, nothing really helped. The cough medicine over the counter, honey, no, nothing really helped. So in a matter of like 3-4 months, I had gone to see 3 different doctors, and they all had their take on my cough. I had been prescribed antibiotics, steroids, inhalers, and I ended up with different types of allergy medicine. I still had the cough, same severity, nothing changed, and I also had an x-ray done and a CT scan, and there was nothing wrong with me. I'm like, is it my imagination? People close to me had said, well, maybe it's just in here, and I'm like, it's not, and I don't have a tickle on my throat. I don't know how else to explain it, and if it's here, why is it only happening if I'm talking or laughing? Something is triggering it, right? So it was very frustrating. So I had gone to see, I was referred to a pulmonologist. he was convinced it was allergies. So I ended up being on 4 different kinds of allergy medication, just giving it a try, you know, like, okay, I know it's not allergies because like I said, I had experienced different living arrangements in the last few months for different days at a time. I had not changed anything in the household that was, you know, like, I don't know, products for the laundry or things like that. I couldn't really come up with anything. So he finally decided to give something else a try, and this worked. So let me tell you about it. It's called Gabapentin, and I am sure that you have heard this name, the name of this medication in the past. And I know it is prescribed mainly for people that have epilepsy and nerve pain. I don't have either of those 2 things. But I was prescribed a very low dose, and I'm gonna be very straight to the point here. And by the way, one thing I did forget, I had done also blood tests to rule out other things, you know, and it came up with things that I had a year before that, which, anyways, I'm not gonna go into that because it's not related to it. But, you know, like different things had been done to really see like what's going on with me, right? Nothing wrong. So I started with a 300 milligram dose of gabapentin, and for the first time I actually saw a little bit of improvement, but that did not happen for like 2 weeks. And when I would tell the doctor, he would be like, it took 2 weeks? I'm like, yeah. And I said it didn't, he could tell that I was still coughing, but I wasn't coughing at every sentence anymore. It was kind of like a diluted cough. And he decided to go up. So he said, take double, let's do 600. So I started taking 600. And again, it took a couple weeks before the full effect of it. And it also decreased a little more. So I was pretty happy, like this is the only thing that actually has helped me. But it didn't get rid of the cough to its entirety. So the next time I went to see him, I told him, and he could see that I was still coughing a little bit, but not like before. So we went up to 800 milligrams. And then he said, if at some point you no longer have cough, you can start decreasing it and see what happens. So at this point, I'm at 800 milligrams, and I've been on it for about a month and a half, something like that. I've got to tell you guys, as you can tell, 0 cough. Amazing. Like, it's amazing, right? I mean, I'm coughing. I'm laughing. I'm not even coughing. It would be like a little laugh at, you know, it was just so annoying. I'm no longer doing that. So it works for me. Now, I'm not going to say that all dry coughs that are persistent can be treated with this. I am not a doctor. I'm not telling you what to do. I'm just telling you my story so that maybe this is something to think about, and maybe bring it up to your doctor. So let's talk about side effects. So yes, there are some side effects to this medication that I currently have. The first dosage of 300 milligrams, it really didn't do anything, right? But when I started going up, I did see that I am hungry, guys. Like, I probably have gained about 4 pounds, something like that. I'm not happy about that. But overall, I mean, because I feel more confident that I can do videos like this, because I wasn't posting videos because I would have to do retakes, and by the time I was doing the retakes, I'm like, you know what, I'm just not posting it this time. So that's one of the reasons why. But yeah, being hungry is one of those things that I don't like. Also in the morning when I get up, I have a little bit of blurry vision, especially like if I have to, you know, look at a document or something like that. I need glasses or my phone. If I need to look at my phone first thing in the morning, like I need help. I need glasses. And yes, guys, I'm in my 50s and I do need glasses for little print, but not for my phone. So that's one thing that I have had to adapt to. But I am pretty sure that if I do get off the medication, that I should be back to what my 50-year-old body, 50-plus-year-old body is like, right? And what else? Yeah, just being a little sleepy. Like, it makes you a little sleepy. For me, particularly, you know, I will take the medication 2 hours before I go to bed because that's how long it takes for me to be a little sleepy. So, but then in the morning I'm fine. But again, everybody's different. So those are the side effects for me, guys. The funny thing is that gabapentin is given for other reasons. I went to the vet the other day for my cat, not for me. And my princess, because that's her name, she was not very happy. And she got there and she was hissing. And so the vet gave me gabapentin for her for the next time that I bring her in. 100 milligrams. So I was just like, okay. But I've got to say that I know that that's for anxiety. I don't feel like I have anxiety, and I don't think that it has done anything different. Like, I honestly, like, I don't see any difference in anything. But I just wanted to, you know, just let you know what my experience has been. At this point, I feel very comfortable, and I am almost ready to start decreasing the medication, and that will be super interesting to see, like, is the cough returning, you know? So I definitely will have to do an update because I know that this is going to be important to you, especially if you're here watching this video for this reason. So I definitely will do a follow-up. It might take me a few months because of course I have to see like how it goes. But yeah, that is what I have for you today. I know that this is not the average video that I usually post. So give me a thumbs up if you appreciate this video. And yep, I will talk to you soon. Thank you so much for, you know, always supporting me, and you have a great day. Take care. Goodbye.